Hi, my name is Cassandra Maldonado and today is the 7th of May 2013. The purpose of my video is to demonstrate my clinical and communication assessment skills with reference to 5 different clinical procedural skills. Throughout my video, I'll be verbalizing step-by-step instructions on how to palpate a radial pulse, how to measure a respiratory rate, how to palpate and auscultate a blood pressure, how to auscultate a chest, and finally, how to perform a full Glasgow Coma scale on a patient. For each skill, a minimum of 6 verbal communication exchanges will be demonstrated. The purpose of these verbal exchanges are to demonstrate how to obtain patient consent before performing a skill, how to address the patient appropriately and respectfully, and how to use language that the patient can understand. For each skill, 4 non-verbal communication skills will also be demonstrated. The purpose of these non-verbal communication skills are to demonstrate how to establish empathy and rapport with the patient. These verbal and non-verbal communication skills will be highlighted to the viewer throughout the video. As a paramedic, I'll be attending a Code 1 call for suspected chest pain. My patient's name is Mrs. Jones and she is 78 years of age. Now I'm going to demonstrate how to take a pulse and respiratory rate on Mrs. Jones. Mrs. Jones, is it okay if I take your pulse?
That's fine.
Have you ever had your pulse taken before?
Yeah, many times.
Yes, just at the GP?
Yeah.
So now I'm just going to feel on your wrist, so just let me know if you feel uncomfortable at all.
Sure.
I'm just going to place 2 fingers on Mrs. Jones's wrist and feel for her radial pulse. And once I found this pulse, I'm going to record that for 30 seconds. If it's normal, I'll just times it by 2 so I've got her total for a minute. And if not, I'll continue counting for a minute to get a more accurate result. 4 non-verbal communication skills that I've used with Mrs. Jones while taking her pulse are that I've maintained eye contact, I've kept a relatively comfortable distance between us, I'm using a reassuring tone, and I've given her time to answer my questions. Okay, pulse seems to be normal, Mrs. Jones. So you said that it's normal. The GP's always said that it's normal. I can't see anything wrong with it at the moment. So now I'm just going to demonstrate how to take a respiratory rate on Mrs. Jones. So without her knowing, I'm going to count how many breaths she takes in 30 seconds. And if that is normal, I'll just times it by 2 to get 60 seconds. So I'm just going to continue having a look at your pulse, Mrs. Jones. Is it okay feeling your arm on your chest?
Yeah, that's fine.
So while I've got my arm on her chest, I can feel her breaths without her knowing that I'm measuring her respiratory rate. 4 non-verbal communication skills that I've used with Mrs. Jones is that I'm still keeping an adequate distance between us so that she still feels comfortable. I'm using eye contact, I'm smiling at her, and I've given her adequate time to answer to my questions. Okay, Mrs. Jones, you don't have asthma or anything, do you?
No.
You're not feeling like you're using extra effort to breathe now that you've got some chest pain?
There's a little bit of a strain.
Just a little bit
there,
more? Well, your breathing rate seems to be normal, but you've never had trouble breathing?
No.
Everything's always seemed to be normal?
Yeah.
Well, it seems about fine, so I'm just going to move on. Is it okay if I take your blood pressure?
Yeah, sure.
Okay, now I'm going to demonstrate how to take Mrs. Jones's blood pressure. Mrs. Jones, I'm just going to need you to take off your jacket while I take your blood pressure so I can get a more accurate reading.
Yep.
Have you ever had your blood pressure taken before?
Yeah.
Quite a few times?
Yeah, pretty old dear.
Yeah, that's fine. So you know that it's just going to get a little bit tight and uncomfortable. Just let me know if you feel uncomfortable,
Yeah.
and I'll just
Thank
stop.
you.
Okay, so now I'm just going to feel for Mrs. Jones's radial pulse. And once I've found her pulse, I'm going to pump up the blood pressure cuff until I can no longer feel this pulse. Once I've reached this point, I'm going to slowly release the pressure on the blood pressure cuff until I can feel her pulse again and record this as her systolic blood pressure. Blood pressure seems to be normal so far. You've got relatively normal blood pressure?
Yeah, I think so.
Yeah.
My doctor says I'm pretty
Yeah,
good.
it seems pretty good so far. So I'm just going to have another listen.
Yeah.
Okay, I'm still going to keep the blood pressure cuff 1 inch above the crease of Mrs. Jones's elbow, and I'm going to feel for a brachial pulse. And once I've found this pulse, I'm going to place the diaphragm of the stethoscope directly above it. And I'm going to pump up the blood pressure cuff until I've reached just above her systolic blood pressure. Once I've reached this point, I'm going to slowly release the pressure in the blood pressure cuff. At first, I'm going to hear her brachial pulse, which indicates her systolic blood pressure. However, when this phases out, I'll record this as her diastolic blood pressure. Well, everything seems to be normal, Mrs. Jones. So, like you said, you've got.
Yeah.
Hopefully, that wasn't too uncomfortable for you.
That was alright. Fixed it.
So, 4 non-verbal communication skills I used when taking Mrs. Jones's blood pressure were that I still maintained an adequate distance between us. I maintained a reassuring tone, I used eye contact, and I also gave her adequate time to answer my question. Now I'm going to demonstrate how to auscultate Mrs. Jones's chest. Mrs. Jones, is it okay if I have a listen to your chest?
That's fine.
Okay, let me know if you feel uncomfortable at all and I'll stop.
Okay.
So I just need you to lean forward for me.
Yep.
And take 2 deep coughs for me. I would normally do this on Mrs. Jones's bare skin, however today I'm just going to do it on top of her shirt. So I'm going to listen for 2 cycles at 8 different points, so therefore I'm going to listen for inspiration and expiration at each of these points. So Mrs. Jones, I just need you to keep taking some deep breaths through an open mouth for me.
Yep.
What I'm listening for is so I can hear the air travelling from the top of her lungs to the base of her lungs. 4 non-verbal communication skills that I'm using with Mrs. Jones are that I've given her sufficient time to answer my questions, I'm using a calm tone, I'm keeping an adequate distance between us, and I've also placed a reassuring hand on her shoulder. Like you said, Mrs. Jones, you've never had any trouble breathing, you don't have asthma?
Not that I know of.
Well, your lungs seem to be normal, so is it okay if I continue with the rest of my assessment?
That's fine.
Now I'm going to demonstrate how to assess Mrs. Jones's conscious state using the Glasgow Coma Scale. Mrs. Jones is following me with her eyes, and her eyes are responding to my voice. Therefore, she receives a score of 4 for her eyes as she is demonstrating spontaneous eye opening. Mrs. Jones, is it okay if I ask you a few more questions?
That's fine.
They might seem silly and irrelevant, but they'll really help me out today.
Okay.
So do you know where you are at the moment?
Yep, this is my house.
And do you know why I'm here?
Just for the pain in my chest.
And also, what day of the week is it today?
It's Wednesday.
And what month are we in?
May.
And the year?
2013.
And finally, what season?
Autumn.
Mrs. Jones is orientated to time, place and person, therefore she receives a score of 5 for a verbal response. Mrs. Jones, is it okay if you squeeze my fingers and let go? Mrs. Jones is able to do as I ask of her, therefore she receives a score of 6 for a motor response. Altogether, Mrs. Jones has achieved a perfect score of 15 as her GCS. 4 non-verbal communication skills that I've used with Mrs. Jones are that I still maintain an adequate distance, I was using eye contact, I used a reassuring tone, and also I gave her sufficient time to answer my questions.